Welcome to this episode of Burst. On today's episode, I'm going to be showing you what it's like to be an RDHAP. I have 3 patients scheduled, so it's going to be really exciting. I'm super happy that Burst invited me to be on their YouTube channel, which is super exciting. And so I'm just going to also introduce to you my mom, who's actually a registered nurse. She recently retired and she joined the Bright Bites team. And so I just wanted to talk to you a little bit about what an RDHAP is, what we do on the daily, how we get it done, and why I even started this. So an RDHAP is basically, I know a lot of you are from all over the country, and so what it is, it's a registered dental hygienist and alternative practice. So in the state of California, you can get a special license after you've been a registered dental hygienist for a while. You have your bachelor's degree, you need at least 2,000 clinical hours in a dental setting. Then you can take a course, and then once you get the course, you have to apply for, you take your law and ethics exam, you take get a bunch of licensure from the California State Board, as well as your city, a DBA, all these different components, and then you can start working and practicing. And so I really wanted to go and help people with special needs. It's something very special to my heart because my mom's sister, who we're going to be seeing today, my Aunt Sandy, she has cerebral palsy, and her husband has cerebral palsy as well. I grew up, I was raised by my parents, but my mom was a nurse. She showed me a lot of really good work ethic, and she went to school while we were young. So she was always in school. She got her bachelor's degree, her master's degree, and during that time I had an amazing support system from my grandparents, and my grandparents took care of me, and they also took care of my Aunt Sandy, who had cerebral palsy, and my great-grandmother, who had dementia, like severe dementia, who died at 103. And that allowed me to be around different abled people, and it allowed me to see that, you know, there is a lot of individuals out there who just need a lot of love, a lot of attention. And, you know, my great-grandmother had dentures, and so it was something that I was very, very aware of, like, oh, you get old, you're gonna lose your mental health, and you're gonna also get dentures. That's like what my reality was. And now that I'm an RDHAP, I strive to help patients so that even if you do have dementia, you don't lose your teeth. And, you know, my grandmother is 92 now, and she still has all her teeth. You know, a couple implants, but for the most part, she really does have her teeth. My Aunt Sandy has all her teeth, and so it's something that has been like instilled in me. If you take care of your loved ones, if you help them, and if you help others, that they can have their teeth. And so I'm super excited to show kind of what I do on the daily. Why I did this is because I really want to have the general population and the people that really need it the most have access to dental health, because in reality, it's very difficult to get someone to a dental office. It's like the last thing on the list. So having my mom as a registered nurse has been very helpful, because she helps get all the charts together as far as reviewing the medical history, taking the patient's blood pressure, and then getting medical clearances from the doctor and things like that. If there's medication, like, you know, contraindicated medication, we always want to make sure that the patient's going to be able to be seen. So a lot of them are medically compromised, but we work as a team to getting them healthy, getting them, you know, on a really short recall and things like that. So we are in the Bright Bite headquarters right now, which is basically my office in my garage. And so I'm just going to kind of show you around to the office. And if my mom wants to add anything.
I think he's did a wonderful job of explaining.
Okay, so in my back office, I have all my supplies, and basically at the start of my morning, I come back here and I start making my trays for the day. So I have 3 patients today we're going to be seeing, 2 with cerebral palsy and 1 that's on long-term hospice care. And so what I do is I come back here, I have everything that you would have in a normal dental practice. So I have all of my sterilization stuff, bibs, gauze, I have water tabs for my unit, I have tongue scrapers, I have everything you can possibly think of. I have lidocaine, just to put like the topical just to put when I probe or when I'm doing a cleaning. And then I have my lab coats and just a bunch of different things. So I'm going to show you how I set up my trays and things like that. In addition to that, I also have my sterilization unit here, which I'll show you after I get back. I always run my instruments and things, and I always test to make sure that the spore strip is coming back, that everything's sterile and things like that. I also have a refrigerator back here, so there are a lot of products, Cervatec Plus or things like that, that need to be refrigerated, so I keep them in the refrigerator. I have cups and napkins and everything you can possibly think of. My favorite part is my saved jar of teeth, which basically is a reminder of perio exists. So if you keep your gums healthy, you can keep your teeth for life, but if not, there are some fallen soldiers here. So let's get started. So basically what I do is I grab my tray. So I'm gonna make 3. So I grab the trays and I kind of just rock and roll. Always make sure to have my loop light charged and in my box. And then I also make sure to have everything like sterilized. All that stuff needs to be labeled really well. So I make sure that that is all labeled. This is like the puzzle time. So, and if you see there's the biohazard box, there is the sterilizer. Everything needs to be labeled. This is my suction unit. And then we break down a little bit of this tray and we put it in there. I am 9 months pregnant, so my mom, or 8 months pregnant, so my mom helps me pick up everything. We've arrived to our first location, so we're getting everything out. So good morning. This is my Aunt Sandy. And this is going to be our second visit where I'm going to be cleaning her teeth in the comfort of her home as well as her husband's first time. And so it's just a really great experience for both of us because my aunt, even the caregiver, just watching her behavior in the chair, she was like, wow, this is the first time that I've seen Sandra relax while getting her teeth cleaned, and it was a really easy process. We didn't have a lot of stress. It was very easy to just make sure that everything, was healthy and things like that. So today we're just gonna follow up. Anthea, how are you feeling today?
I'm great, thank you.
Well, good. So she said she feels great, and are you ready to get your teeth cleaned?
Yeah.
All right, let's do it. And this is my mobile chair, we have a mobile suction, we have my mobile ultrasonic, everything going, and this way she can get her teeth cleaned really comfortably. Okay. So it's really important to work with the caregivers. We get my aunt comfortable in our chair, and now we're going to take her blood pressure while she's still sitting up.
Not the numbers or anything like that.
And at the start of every appointment, I take take pictures before and after. It's super important. I think a picture say a million words. Just helps so the patient sees too like what's changed, and we can document how the gums have improved. It's my favorite thing in the world. I just love it, and that's why a lot of you see my pictures on social media, because it just makes such a big difference as far as how the gums change and get healthy. Healthy gums are tightly bound to the tooth. They're nice and pink, and unhealthy are bright red and inflamed, and so it's really great to just kind of show the patient. So I just use the sticky bib, and then any of my trash, I just throw it in the biohazard box, and then when I get home, I just go through and sort everything. So I always wear a disposable gown for myself as well, because I use the ultrasonic, and so I think it's just better to have the disposable gown, and also it breathes a little bit better, and since I'm expecting, I'm always warm, so that's pretty much great. And then my mom's working on making sure the patient's chart is all up to date. Nothing's changed with the medical history. Medications are still the same, and so we always just kind of go through and make sure everything's the same. So I love the Montana Jack. I have my mirror. I have, like I said, my Explorer. I have my probe. So if I had to say like my favorite instruments, I have a 1718. I love that. I have a mini. So I honestly feel like my favorite instruments are the good old Explorer and probe, because I need to do that with every patient. That's for sure an instrument I will use. So I like to prop them up like this. I put my Profi angle on my polisher so it's ready to rock and roll. I have my disclosing solution. So we're going to start with the pH, open and close. This is just going to see how acidic your mouth is. And so, one more time. You need to have at least a little bit of saliva on there for about 15 seconds. Then I look, and then I'm going to let it dry for a second. Then I look at the comparison strip on the bottle. And then this will help me, and I document it in the patient chart as well. So my aunt is at 6.25 for acidity. And so now we're going to start with taking photos and measuring gums. Okay, so I've switched out patients, and I've cavity wiped everything once. I'm cavity wiping everything a second time and opening up everything that's sterilized and new and fresh because we are switching patients. So I pour out the used water, fill up the re-water, and then I cavity wiped all the chair, new, and then I switch out and have my new instruments ready to go. So my mom's going to be taking our next patient's blood pressure and getting everything, reviewing medical history, and then I'm just resetting up for my next patient. Transferring to our chair. Getting nice and comfy. Yeah. Okay, I'm first going to take the pH. Sierra, la boca. It's like a 5.5. All right, so we just finished our second cleaning, so I'm gonna go ahead and start cleaning up everything, but I just wanted to see how Jose feels. So how do you feel? ¿Cómo se siente?
Very good. Thanks.
And so we finished up everything. Auntie Sandy, how do you feel?
Very good.
Very clean. So I'm so happy that they feel great, and now it's time for cleaning up. So now that we're back, I'm just gonna show you, I'm gonna leave everything back here because I have another patient. But what I do is I take out the biohazard box and I take everything out of here, disinfect everything, throw everything that needs to go into the ultrasonic, and then into the sterilization unit, and we get everything all sterilized. And then once I get back from that, I will run the sterilization unit with all of the instruments we used today. We're back in my little office space in the garage, and so I have about 30 minutes or so before my next patient, and so I just wanted to give you like a little recap of like the differences of being an RDHAP and then working in private practice. While in private practice, it's like back-to-back patients. You really don't have to like sterilize your own instruments. If you have a lot of assistants, they help you like set up everything. But here I have to like run in, get the biohazard box, take all the instruments, put them in the, get everything all going. Running your own business means you do your own marketing and you have your own supplies and ordering and making sure all your instruments are all set and ready to go. So it's a lot of work for you. It's a different type of work. So even the charting and getting all your patient like consent forms all set up, like you normally have a front office that will do all that. And when you own your own business, you are doing it all. So I think there's a big difference. I love what I do. I think that it is a lot of effort. It's definitely a lot more work being an RDHAP because it's the running back and forth and packing up and unpacking, and it's just a lot of legwork in between, but it's so rewarding, and I love it. I love that I'm able to help somebody who really may not be able to have that help. It's been such a blessing, and I'm so grateful. And anyone who has any questions about being an RDHAP, or they're scared or they're nervous, like message me, let me know. I'm here to help. I would love to help others become RDHAPs. Thank you so much for joining me on this little adventure. I'm still gonna continue to go for the day, but thank you, Burst, for giving me this opportunity to show you what it's like to be an RDHAP.